next speaker is Dr. Kaushi Kanankege. Kaushi is a researcher in the Department of Veterinary Population Medicine, College of Veterinary Medicine, University of Minnesota, and her research involves the use of spatial epidemiology to solve One Health problems. So, Dr. Kaushi, the floor is yours. You're welcome.
All right. Thank you, Valeria. I hope that you can see my screen. So like Valeria said, my usual area is spatial analysis in One Health. And I would focus on mostly rabies today, but I have worked on multiple different One Health scenarios and how to use spatial analysis to give some answers or at least bring answers together. So there are many One Health problems that we could address using spatial analysis. That could be either zoonotic diseases like rabies, food safety, or antimicrobial resistance, or even wildlife trade, because we are taking into account the space and the time and how we interact, the human interact with animals, as well as the environment that we share together. Now, like I said, I'm going to choose rabies because one, I have escaped when I was a kid in Sri Lanka. I've escaped a rabid dog by climbing a tree. So even today, rabies is a common problem that affecting a lot of children in Sri Lanka, as well as many other countries around the globe. And finding a solution to rabies, even though this is a pretty old disease and have solutions, still neglected, therefore a neglected tropical disease, has been a challenge. Many of these countries are developing or else have difficulties in handling both human and animal side together, or bringing these sectors of or silos, I guess, together to address a One Health question. No matter all the conversations that we have had before. So rabies is a viral disease that affects the central nervous system and transmitted. It is zoonotic, transmitted from dogs, cats, foxes, and other wild animals. And it is vaccine preventable, but it is deadly if it was not treated timely. What can spatial analysis do to help rabies control? Now, this is a question that I had when I was participating back in Sri Lanka in dog population control and rabies control program, that when we go in, let's say, to a different area that we want to implement the control program, we find some of these dogs were already addressed by a different organization, and there is no coordination. And also, if we had a kind of a risk-based approach, risk map at least, at the very beginning, to see which parts were addressed and which parts we could address later on, that would have been really helpful to use these limited resources in developing countries to address the question like rabies. So pretty much, a spatial analysis could help us to understand where the risk is and identify what are the modifiable environmental determinants that is related to the disease, and then plan risk-based surveillance as well as risk-based prevention and control. That could be vaccination, population control, education programs, as well as providing accessibility to the human vaccines and PEP. Now, before I go into more detail on the rabies study, I wanted to just touch base on what is spatial epidemiology, that is bringing the geographical variations of a disease and with respect to the demographic, environmental, behavioral, socioeconomic, and infectious risk factors, because by doing that, we can identify where the disease clusters are at, how the disease is spreading, and what are the modifiable environmental determinants. So to do that, we could, if let's say that we have the disease data as well as the the risk factor data, we could initially do visualization and analysis to understand the patterns of the distribution. And eventually, use modeling techniques such as interpolation or correlation models to bring these disease as well as the underlying risk factors together to predict risk areas. Therefore, we need data, software, trained personnel, and also decisions to inform. In this case, it could be, so let's say, a surveillance program to inform. Where do you want to focus more on? So now, because I have been referring to Sri Lanka, you probably think that I'm going to go into Sri Lanka and bring in addressing a question in Sri Lanka, but turned out that the opportunity that I had was in Thailand. Therefore, we collected data from Thailand during the time that was very critical for Thailand because they have had a good rabies control program. However, in 2018, while we were just initiating the project, they had a huge rabies outbreak in the dog population due to many factors: vaccine failure, neighboring countries that had different effort levels in rabies control, and animal migration across borders. So it was a perfect, I guess, example location to test this use of spatial analysis. So to do that, we collect data from both human and animal cases, as well as the underlying risk factors, and then did a spatial regression. So one of the correlation models that I listed in the framework to come up with a risk map. And most of the data that we bring together, as we listed here, you can see comes from many different platforms. For example, we collected human and animal disease data from relevant public health and animal health departments, but also the data from, for example, Buddhist temples. How does that even play a role, right? So Buddhist temples, in general, a lot of religious places allow these street animals to shelter and provide food. And therefore, these are indirectly, I'm not saying that this is the wrong thing, but it is indirectly providing a correlated factor that in a situation where we don't have proper data, this is a indirect way of addressing or collecting data that is contributing to the disease or the population. And similarly for garbage dumps, again, a source of food. We collected data at very different levels because that's the data level that we could access. And some of the data that we really wanted to know, like neutering campaigns and how they're going, or open markets, we were not able to even find reliable data. But what we're trying to do is use what is available and use this spatial modeling technique to come up with a solution and test if it was used, can it be useful in predicting for a risk scenario. So this is the data we have. So from 2012 through all the way from 2017, as you can see, there's a slight increase of the cases towards the latter. So this is the distribution of human and animal and rabies in Thailand. And these are the distribution of the risk factors that we considered. Now, bringing them all together, we used a spatial correlation modeling technique called zero-inflated conditional autoregression model. So we could think of it as regular regression model, but added space factor to it. So what it does, simply put, is in addition to controlling for the correlation between the factors and the disease, we also account for the closeness between different districts in this case. If a district that is close by has cases, then that poses risk to the neighboring districts, and we bring that element together into the modeling technique. And that's what the benefit of running a spatial regression compared to a regular regression is bringing as an added factor, right? So we consider many different factors, including shared country borders, the dog population, number of dog bites, how the PEP is distributed, and how the animal vaccine was distributed. Now, I'm not going to go in detail into this particular slide that looks very crowded, but simplified, this is the gist, that we find key determinants that are determining or correlated factors that we could use to predict for human and animal rabies is number of Buddhist temples, shared country borders, total dogs and cat, total dogs population, number of dog attacks that were reported, garbage dumps, as well as shared borders with other districts. So bringing all these factors together, we developed a risk map, and then we also did cross-validation. That is, you can come up with this map, but you don't know if it's actually helpful, right? So to test the use of this method, we did a cross-validation. We could do two techniques in cross-validation. One, we could remove some of the districts and then predict for the district later on, like a testing and training and testing. But here we did over time. So what I did was divided the data into training from the data from 2012 through 2015, and then tested for the cases that happened afterwards. And the results showed that a pretty good outcome. So what it says is, if we had used this kind of a model in 2015 to predict the cases that happened in 2016 through 2017, 71% of the districts that reported at least one case would have been accurately predicted by the model, and 80% of the districts that predicted to have no cases would have not reported any case in that testing period. Now, pros and cons of this is a model. So all models are wrong, but some are useful. So there are limitations to the analysis as well as the data limitations. But what I wanted to bring together here is that we don't have to wait for the perfect surveillance. We could use the available data and use modeling techniques such as the spatial epidemiological technique that we just used here, and come up with risk-based, at least estimates, to bring together these stakeholders and have a conversation. Let's say the human health groups, the garbage control, or even Buddhist temples, and bring these stakeholders together that you don't necessarily think that need to come together for our solution to a one health problem such as rabies. And this has been exemplified in many other different disease situations, such as what we learned from COVID-19. With that, I would conclude my presentation, and kudos to you all, and also to Valeria for organizing and joining this conference in these difficult times. And I am really grateful and privileged to be connected to you all and present this study. Feel free to ask if you have any questions, and I'll be around. And also feel free to email me too. Thank you.
Thank you so much, Kaushi. It was really nice to hear. And, you know, rabies is a problem for Ukraine as well. Unfortunately, we're struggling to eradicate this disease. So it's very good to know the experience of other countries. And unfortunately, we don't have time for questions because we are so late. And we have to move to our next speaker.